Ladies and gentlemen, welcome to the new tutorial video. Today we are show you how you can make special reconstruction for partial denture. This video was live with the student of the Dentistry College, University of Suleimania, 5th semester. Thank you. Dears, today we try to construct a special tray for partial denture by the cold cure acrylic or self-cure acrylic. As you know, special tray for complete denture have two techniques, close fit technique and with the spacer technique. But for partial denture, we have one technique only. It was with the spacer technique. At first, we apply a thin layer of separate medium. Today, we apply by cold mold seal material for separation as an isolation. Then we draw the outline of the special tray design, and then we use the modeling wax as a spacer, 2 layers. I think it was enough on the natural teeth. You see, we use a modeling wax by softening it and put it on the natural teeth and adapt it on the natural teeth. So we can do relief for the undercut by the wax, tissue undercut or teeth undercut. But in the teeth undercut, we don't have teeth undercut because we relieve it by the double layers wax. Only maybe we have undercut in the gum tissue on the model. To be easy, put the special tray in the patient mouth and remove it from the patient mouth. Not interfere with the gum of the patient and maybe injury in the gum. We try to relieve it by the wax, or when we do finishing, we relieve these areas. This is the conversation with the students when they ask me about the demonstration. They ask, can we use another material for the spacer? I am answered them. In this time, no, only we have wax as a spacer. And it's easy and available in all the labs and cheap. We try to cut the excess and when we say spacer, should remember we have a stopper. The stopper with the spacer in the same work. Why we put stopper? The stopper is very necessary for the spacer. The main reason it was to determine the thickness of the impression material, which we use it for taking the final impression for the partial denture. This one. And if we don't make a stopper, maybe when press the special tray in the patient mouth by the force, the spacer is loose. So we can't do the stopper with the spacer in the two different sides and anteriorly and posteriorly if we have natural teeth. After that, remember, we should apply a separate medium on the cast. All the surface which contact with the special tray construction material. Today we talk about cold cure acrylic, not be stick and cohesive, and be easy to separate the special tray from the model. Here you see, I'll try to draw the outline of the special tray. As you know, the special tray in the edentulous area at the last, it should be under extension about 1 to 2 millim. That means 1 to 2 millimeter away from the sulcus area. It was to let the tracing compound sticks when use it in the clinic, or when the dentist use it in the clinic. We let him use the tracing compound sticks to determine the sulcus area perfectly, not over and not under extension. This gives us a good and perfect periphery and good and perfect final cast to construct the partial denture later. At the primary cast or primary impression, maybe we are not seriously take the flange and sulcus. Maybe it was overextension because maybe use impression material look like alginate or silicone, heavy body and light body. It was make overextension in the patient mouth, but in the final impression, we try to make underextension in the labial or buccal flange. We make underextension in the buccal and labial flange for the edentulous area only. In the complete denture, because the patient was completely edentulous. So when we make a special tray for the complete denture, we made under extension around the flange from anterior to posterior, labially and buccally, under extension about 1 to 2 milli, because all the whole of the patient mouth and jaw was completely edentulous. The difference in the partial denture, we say partial denture. Partial denture, when we have remain one tooth in the patient mouth or patient jaw, two, if we extract or the patient have one missing tooth, this is called partial denture. So the edentulous area is not completely, partially. So in the labial or buccal flange, for the edentulous area, we do under extension about 1 to 2 milli. You see, today we use a spirit lamp because it was safe and give us a good flame to do our work. It was perfect for the student, student in the College of Dentistry or technology college to work in the house or to work in the lab. It was good, better than the gas burner, because maybe the gas burner or the pipes have issues, leaks in some points, and it was danger for the student or dental technician which work there. You see, here I was applied a thin layer of separate medium at the whole of the cast. If you apply the wax, it's not issue and no problem. It's easy. But if we don't do that, it's easy too, because the wax should remain removed after the construction is complete, set. And it was easy to remove it by the hot water or by the wax knife or lacron carver by the hand, because the hot water melt the wax and remove it from the position. Here we use cold cure. This is a liquid cold cure acrylic, and we mix it with the powder cold cure acrylic. It should be the same type. That's mean not use liquid or powder in the differences types. One of them hot cure acrylic and another cold cure acrylic. It should be used liquid cold cure mixed with the powder cold cure acrylic or self-cure acrylic or autopolymerization acrylic. The ratio is 1 to 2, and it was according to the company instruction leaflet, but universal use, it was 1 to 2. That's mean 1 milliliter or 1 cc liquid with the 2-gram powder. Here I was use my experience to mix by this technique, sprinkle method, in the porcelain jar, and it was not clear. Because if we have, or if we use a clear jar, maybe the mixture maybe the mixture reaction with the light, and this is do bad mixture. So we use the porcelain jar, and when we complete mixed about 10 to 15 seconds and closed by cover, not to be evaporate the liquid, because if the liquid evaporate, the mixing ratio is destroyed. So we try to make a perfect ratio, because to provide a perfect mixture and good construction special tray. Here I try to tell the students the steps of the polymerization for cold cure acrylic. When mixed, it's called mixing step or sandy step. This is the first step, sandy step. After that, to be sticky stage or sticky step, we can see the sticky step. When mixed, we can see how is it the shape. In the sandy stage, the mixture, when use moving the jar right and left, we see it was flow. In the sticky, it was not flow. Time to time, I want to test it to see which steps reached. As you know, the first step was sandy step, or sandy stage, then sticky stage. After that, dough stage, and cold work stage. Why? Because we used the mixture at the dough stage. This is the only stage or step we can use the mixture to construct the special tray, or if we use it to construct the record base. And working time for dough stage according to the room temperature. One of the students asked me how the time take to reach the dough stage and the work time for the dough stage, how we know the time. I answered him. the time of work stage and the time to reach dough stage, and after that to rubber stage and hard stage, it was depend on the room temperature. If we work in the cold weather, we see the time of the polymerization, it take more time. And in the hot weather or hot room temperature, we use less time for the polymerization time. And you know, this is the steps of the polymerization: sandy stage, sticky stage, dough stage, that's mean work stage, after that rubbery stage, and hard stage. Here we try to waiting for reach the dough stage. We should put our fingers in the some water, because maybe the mixture have a little sticky, not to be stick with our fingers, to do manipulation for the mixture. You see, this is a sticky stage.